My name is Andy Barnett. I am a physician assistant at Froedtert Medical College of Wisconsin in the Orthopaedics department. I attended the University of Wisconsin-Madison's physician assistant program. I see patients from infants to adulthood. I'll see patients for any issues from the shoulders down to the hand, so that includes shoulder arthritis, rotator cuff injuries, shoulder separations, shoulder dislocations, fractures anywhere from the shoulder down to the fingers. I also see tendonitis of the elbow. I see peripheral nerve issues, including cubital tunnel and carpal tunnel syndrome, which can lead to some numbness and tingling in the hands and the arm. And I also see tendonitis of the wrist, trigger fingers, as I had mentioned, fractures to any of the wrist or digits, and as well as nail bed injuries. My approach to patient care is I like to have an open conversation with the patients. I think it's important in order to treat them appropriately to understand what they're trying to get out of the appointment, as well as trying to inform them as much as I can about their disease process that's occurring, so that they can make the right decision about how they want us to approach their care going forward. I think it's important to just make sure they realize all the options that are available for them for treatment of their issues, so that we can make a good decision about what's the best appropriate next step for them. I like the fact that at the end of the day I know that I'm always giving it my best to try to make people feel better and do better. In many cases I think we are able to accomplish that, which is very rewarding to be able to get that out of your job. I ended up in orthopedics because I liked the mix of being able to see people at the very beginning of a problem, and then at the end, if it ends up needing surgery, I get to see them all the way through that process, so that we can see them from while they're in the pain, and then at the very end when you can get that gratification that they're doing better, and that's really rewarding. I sort of pride myself in having empathy and trying to understand where people are coming from when they're coming in with their issues, and try to listen very keenly to what they are telling me, because everybody comes in with their own background, their own story, and I think it's important to understand and empathize that they are going through a difficult issue with their health, and that I take that responsibility very seriously.